Hey everyone, Josh Guttman from Peachtree POCUS, and this is a talk that I gave for the Frugal Innovations and Global Health Conference in March of 2025. I'm going to re-record it for you now. To me, artificial intelligence integrated with point-of-care imaging is the next frontier in point-of-care ultrasound, and I wanted you to hear about both the present and the future of artificial intelligence and point-of-care ultrasound. So let's get going. Today, we're going to explore an exciting frontier in frugal medical innovation, how artificial intelligence or AI and point of care ultrasound are transforming bedside imaging, especially in the low resource settings. Medical imaging has historically been expensive, inaccessible, and centralized in major hospitals. But what if we could put high quality ultrasound in the hands of any healthcare provider anywhere in the world at a fraction of the cost? By leveraging AI, you're breaking barriers in affordability, training, and access, bringing expert level ultrasound to places where no imaging has gone before. As AI technology improves, it brings us closer and closer to the Star Trek tricorder. For those unfamiliar with POCUS, also known as bedside ultrasound or clinical ultrasound, let's start with a quick overview. Traditionally, ultrasound involves a multi step, disconnected process. The physician suspects a condition and orders an ultrasound. Patient is sent to a technician in a different location who performs the scan. The images are then reviewed by a radiologist, who does not evaluate the patient, who provides a report. Finally, the physician receives the report and integrates it into patient care. So point of care ultrasound changes that paradigm and eliminates the middle steps. Takes a physician and makes them the ultrasound technician who acquires the ultrasound image at the bedside, also takes away the radiologist, so to speak, who is interpreting the ultrasound. The physician both acquires and interprets the ultrasound images at the bedside, enabling rapid decision making and immediate patient care. Here are conditions that can be diagnosed with point of care ultrasound. They range from emergent time sensitive conditions to screening conditions and everything in between. It's also valuable for procedural guidance. Without ultrasound, you would use a landmark technique, where anatomic landmarks are used to perform the procedure, which can account for anatomical variation and aren't as accurate. Using ultrasound technology, you can actually see the needle and needle target, such as the vessel that you're aiming for. By seeing where you're going, it's both safer and more accurate. Ultrasound machines have evolved over time. This right here is a traditional ultrasound. It's a very fancy machine, lots of complicated buttons, and it takes a high level of training to utilize. These machines here came in the late 90s and 2000s. It's known as a cart based machine. It's essentially a laptop stuck onto a cart. There are much fewer buttons and therefore much simpler to use. It is one of the original POCUS machines. In the 2010s and into today, this type of ultrasound machine was released, which is a more advanced version of the laptop machine. There's a larger screen, with better resolution and image quality, but still compact and portable on wheels. This machine brought the quality of POCUS significantly closer to that fancy ultrasound machine. As good as these are, machines continue to evolve. In the late 2010s, you began to see the advent of ultrasound that can plug directly into your smartphone or tablet, bringing the utmost portability. The probe fits right in your pocket. You can just pull out and scan when you need. The extreme portability of these ultrasound machines truly allow for ultrasound technology to be imported to the low resource setting. And the cost is a big reason for that. These larger machines can cost upwards of $200,000. Incredibly powerful, but not as feasible in the low resource setting with high cost and the need for an ultrasound technician to operate. This machine is a little bit better, but still costs upwards of $50,000. So certainly much less than the bigger machines, but still out of reach for a lot of low resource settings. However, once you get into the handheld ultrasound machines, we're getting to a price point that's much more affordable. Can be purchased by the hospital or clinic itself, can be donated with a few small donations, or be brought with the global health physician themselves in their carry-on luggage when visiting that low resource setting. The Butterfly IQ3 is their newest version, but the still excellent IQ Plus and their previous version is still being sold for cheaper. This is an Echo, which is another probe that's even cheaper. So, how do we get these wonderful handheld ultrasound machines into the hands of our low resource physician to be able to help their patients at the bedside? Firstly, it's important to understand that POCUS involves multiple skills. You have image acquisition, the process of putting the ultrasound machine on the patient, getting a clear and interpretable image. Then there's image interpretation, which takes that image that was acquired and interprets it correctly. Lastly, as a treating physician, you have to take the image acquired, its interpretation, and actually integrate it clinically and apply that result to the patient right in front of you. So, how are these skills typically acquired? Traditionally, there are POCUS courses where learners come to a course or an instructor travels to a group of learners. The instructor provides anywhere from a 1 to 3 day or more live course to the learners on patient models. After the live course, learners are not yet competent in POCUS. They must begin using it in practice while having their images reviewed by experts for quality and educational feedback until the learners reach a point of competence and can start relying on their images in clinical care. There are, however, limitations for live courses in the low resource setting. There's funding for travel for experts to the low resource setting to teach. You have to get educators willing to travel. It's much more difficult to get those low resource clinicians to travel to institutions with POCUS expertise. You have an issue of lack of equipment. And lastly, you have issues of political turmoil. It may not be safe for the instructors to go to these areas that need POCUS the very most. Then there are the limitations of ongoing education. Ongoing feedback, education, and quality assurance provides critical feedback to new users. And without experts available for the image review, it cannot be done. So, if there's no quality assurance program, the clinicians will lack confidence in their skills and simply not perform POCUS. They'll say to themselves, I just learned, not sure what I'm doing, so I'm just not going to do it. Then you don't do it. And after not performing it, you get skill degradation. So even if there was a live course, it could end up being a waste of money if they end up losing their skills and not utilizing POCUS in the clinical arena. And so, how do we mitigate all these limitations in the low resource setting? That's where AI comes in. AI brings that expertise to the clinician at the bedside. One of the ways it does this is by assisting with skill acquisition. AI can label anatomy, pointing out what anatomic structures are on the screen, and guiding the user on how to move the probe to acquire a perfect image. And once a perfect image is acquired, the AI knows automatically to save that image so it's available for interpretation. The AI knows what is on screen and exactly how the user should move their hand to acquire an image. Once that image is acquired and autosaved, it can be interpreted either by the physician as a true POCUS exam or be sent electronically to a remote expert reviewer. So let's see some of the AI in action. I'm going to demonstrate the AI via live video demonstrations. Some of these are produced by the company, and some are previous reviews I've done on the ultrasound machine. I'm going to use some ultrasound jargon that those of you with no POCUS experience may not understand, but I'll provide brief explanations. But it's beyond the scope of this talk to explain all the terms. The point here is to show you what AI can do, so don't get hung up on some of these terms. So you're about to see a replay of some videos that were made, and the way the mic picked them up, it sounds like there's an echo, so it's not your computer. I apologize, but you'll still be able to hear everything. Just wanted to let you know so you wouldn't worry. This is the Echonos Cosmos device. This will demonstrate the AI augmented image acquisition techniques I just referred to. Over here is where some of the AI guidance happens. And so if you turn on, you choose your personal long, you can have guidance. So if I turn on guidance, it actually will tell me what I need to do. You can see there in the left upper corner exactly what I need to do to get better view. So if you're new to this, with artificial intelligence, tell you exactly what to do. So sliding up the sternum, I do that, and then it says, okay, fan towards the sternum, rotate, optimize. Probably need to rotate a little bit up here. I'm going to come back down. There we go. It tells me exactly what to do to get a better view, and when I get a great view, it tells me so. I'm going to turn that off for a second. Grading. So it tells you how good your view is. So again, if you're a novice and you're wondering like, hey, do I have a good view? You can get a good view, and then it can actually set to auto capture. You can look at the green below and it's set to auto capture. So that's really cool, especially if you're trying to know what a great view. And then if you're really a beginner and you need to know what everything is, you can have the AI labeling. And it tells you where everything is there, which is really nice. So what's cool is that you can see that I really don't have a great image here, which is my fault and not the machine's fault, because I just don't. So there you can see how it's using all these functions to help guide a novice on how to use the ultrasound. So a user that took a POCUS course can utilize the AI to instill confidence. This is the GEV scan, which is another portable ultrasound machine utilizing the AI developed by Caption AI, which performs similarly to the Echonos. now it's saying, okay, we're going to start with the parasternal long axis, PLAX. Over there, it tells you how to position the patient here in the center. And then you can see this bar here on the left side. And that tells you right next to the image, and it tells you how good of your clip it should be. So I'm going to try to get a good parasternal long axis view. And it's actually telling me, you can see what I need to do. So it says slide up, so I can slide up. If you think that there the clip is good, so it saved it automatically. So that was pretty cool. And so then it moved on to the parasternal short axis view. You can see here on the left, PM is papillary muscle. So now if it says, okay, how are you going to do that? Let's change to the papillary muscle short axis view. And it's telling me, hey, slide up, slide down. What should you be doing? Rock indicator slowly. And I'm moving a little bit too fast, but it tells you exactly what to do. And you can see on the left side, it's telling you how good the image is. If you're not getting a great clip, on the bottom left, you can save best clip 74%, and that's how good it is. And so you can therefore, if you want to save the best clip, you can say that's pretty good. Once it gets into the green, it should start recording for you, which it's doing right now. So onto a different take with a similar goal. This is a startup called Desky, and they made something called Heart Focus. This product doesn't use words to describe what to do, but gamifies the POCUS. The goal is to get your cross on top of the screen's cross, and in doing so, get the perfect cardiac image. Let's take a look.
Start position, the live guidance appears on the screen. Here, the probe is misplaced and pointing towards the patient's head. You now have hints on how to move the probe appropriately to reach the probe's target position. It's just like a video game. The white arrow and cross represent your target. The blue arrow and cross represent the probe. Your goal is to superimpose the blue arrow on the white arrow and blue cross on the white cross. In this example, you must turn the probe counterclockwise to reach the target position. Once you obtain a diagnostic quality view, the ultrasound image is highlighted in green, instructing you to hold your position. Heart Focus will now perform an auto record, meaning that it is recording the clip without you having to touch the screen. Simply hold your position until the green circle completes. And as simple as that, you have acquired your first clips with Heart Focus.
As you can see, this AI allows the novice to produce excellent images. Moving away from the heart, this is an image of a fast exam, which is used in trauma to look for internal bleeding or hemoperineum. If a novice is unsure what they are looking at, the Echonos Cosmos can assist. This quality of scanning it has over here. It has an AI feature, so if we turn on the fast AI, it actually will label it for us. So if you're a beginner and you want to know what you're looking at, you'll see all the labeling over there. So that's really cool. And it tells you, hey, you're in a right upper quadrant view, as you can see over here. So it's really helpful for those beginners. I'm going to turn that off a sec. In my left upper quadrant view, if I turned on that AI, it tells me what's what. So now it's upper quadrant. And so you saw this splenorenal come in and out as you see the labeling. Okay. All right. So here's a startup called ThinkSono. Their platform uses AI to assist a novice in performing a point-of-care ultrasound of the leg to assess for DVT. A DVT ultrasound is performed by compressing the veins. This platform highlights the veins and facilitates compression, create the perfect image. Let's check it out.
On the patient's skin, you'll immediately notice the system highlights the vessels and guides me to the target location. When I'm on target, the system locks on, just like that, giving me a green confirmation box and a confirmation tone. I then proceed to record a 10-second clip compressing the target. This clip is then analyzed by the system, not for a diagnosis, for quality control, ensuring that I am on target, that the vein is in view, my compressions are appropriate, complete, and well-paced, and that the whole clip is of diagnostic quality. Moving on to our second point, the system will once again highlight the key vessels, and you'll hear it lock on to the common femoral vein, bifurcation of the femoral artery. I can then record another 10-second clip, me compressing that vein, which will automatically be analyzed by the system for quality control. When the system accepts the clip, I can save it and move on to the femoral vein in the thigh as our third point. Here again, the system will highlight the vessels, it will lock onto the target, and record our clip.
With this, a novice can perform the exam for either interpretation themselves or to send to a remote expert reviewer. Let's move on to AI-assisted image interpretation. So, utilizing images acquired by the physician themselves, whether AI assisted or not, AI software can then perform interpretations. While most are developed in the cardiac space, AI interpretation for other POCUS exams exist. And let's look at some of these solutions. This is an Echo Iris ultrasound device. Along with a few other ultrasound companies, they have developed an ability to use AI to get an ejection fraction. Calculating an EF typically takes an echocardiogram technician, but AI can assist with that. So let's see how the Echo Iris does this.
I'll go to that, and then we pull up the screen, and this will give us an EF. Let's go to AI. So first, what it's going to do is this is in the automatic mode. Here I'm in the parasternal long axis view, so let me change to the apical 4. So it was able to read the chambers in the apical 4, and you see it's progressing along. And then it gives me EF, and you can save that. Or you can do it again. You can also do it manually if you click on the manual mode there, and it'll still pop up with all the chambers as you see it, and then you can start going. I press the button, and it gives you EF there. That's quite similar.
This is a mind ray machine performing smart IVC. IVC ultrasound helps clinicians determine if a patient is fluid tolerant. This is done partially by calculating the compressibility index. In other words, how collapsible the IVC is during a phase of respiration expressed as a percentage. This startup called ASAP has developed a tool to essentially give a comprehensive echocardiogram report using AI augmented point of care ultrasound. Check out this video.
Now that the scan is complete, let's zoom in on the results. ASAP's AI-powered cardiac diagnosis deliver comprehensive evaluations in just a few minutes. With a simple click of a button, clinicians can instantly view their patient's POCUS results, enabling swift and informed decision-making that directly improves patient.
So even though the video is blurry here, as the video fades out, you can see that results are color-coded. So even if you don't know what the numbers on the echo report signify, the color coding helps with classification. Green is normal, red is very abnormal, and yellow somewhere in between. These results can then be sent to a cardiologist for interpretation or used for real-time medical decision-making. To me, something like this is the future of AI POCUS diagnostics. Moving on to the lung, this is a Butterfly IQ3 that has a B-line counter. B-lines are findings on lung ultrasound which denote interstitial fluids, such as with pulmonary edema. Typically, 3 or more B-lines per lung field are considered abnormal. Typically, the clinician manually counts or estimates, but with the AI tool, the machine will count it for you and give you a number.
I'll go ahead and put the probe on my lung here. And so here's my lung. I clearly have lung sliding. You can see the A lines really nicely. We don't see any B lines, but if you wanted to actually get that in a number, you can see here, there's a lung protocol. It's a line counter over here. And so I'll show you how that works. If you're on the B line counter, it'll count for you. So it takes about 6 seconds, and it'll tell you how many B lines there are. And so I have 0 B lines.
Yeah, here's a company called Deep Breathe that uses AI to assist in other aspects of lung ultrasound. Their studies have shown accuracy in detection of pleural effusions, lung sliding to assess for pneumothorax. Together with the B-line counter, AI can effectively interpret an entire lung ultrasound. This is especially useful where X-ray imaging is not available. POCUS is actually more accurate than X-ray for some of these conditions. AI can also replace a bladder scanner. This Butterfly IQ3 auto-captures the bladder and gives a volume rather than needing to calculate it manually on the machine by measuring height, length, and width.
Which I'm going to press on in a second, then I can get a auto bladder volume. So now I'm on my bladder. Now, if I press on the action button, I can get a volume that's auto-calculated. So right in the middle here, so I'm going to click on the auto volume. Then it'll highlight, so you just have to get your entire bladder in image, and this is in long axis, and calculate it. And then it'll go through and give me a volume.
This is FAMILY, or Fetal Age Machine Learning Initiative. This initiative, a collaboration between UNC Chapel Hill and the University of Zambia, uses POCUS in the 3rd trimester, which sweeps across the abdomen to determine gestational age and fetal presentation. This study, they found that the difference between the AI and the expert was only 0.6 days, and therefore was non-inferior. For fetal presentation, it has a high sensitivity and specificity. Knowing the fetal presentation is crucial in predicting complicated deliveries. Lastly, here's an example of AI assisting in procedural guidance. The butterfly has an AI called NeedleViz, which highlights the needle in blue, making it much easier to see and allow even someone with not as much experience to be able to see the needle clearly where it's going to be able to guide procedures safely and accurately.
Take my needle and approach in plane to see the tip of the needle and the shaft as it approaches the vessel.
AI powered POCUS is bringing expert level imaging to every corner of the world. We are making imaging accessible, affordable, and scalable. AI ensures better training, better interpretation, and better patient outcomes. With POCUS and AI, we're closing the global imaging gap. This is only the beginning. POCUS is no longer just for hospitals in wealthy countries, it's becoming a universal tool for global health. Portable, affordable, and AI assisted ultrasound is changing lives. The low cost AI solutions are democratizing medical imaging, and with AI and POCUS, we can potentially provide expert level diagnosis anywhere in the world. And there you have it, point of care ultrasound and AI together for the better. I hope you enjoyed. And if you ever need for ultrasound program management or point of care ultrasound education, or just want to talk point of care ultrasound, make sure to check out my website, peachtreepocus.com, or contact us at info@peachtreepocus.com. And I'll see you on the next video.